Well, today's date is May 26, 2015, and we're here with a colleague and friend. His name is Richard Shearer, who is a medical doctor from Northern California, Mount Shasta area, and he spent a day with me as an apprentice. And I've asked him to give some comments about what he observed.
Amazing. We saw some amazing things. Some of these ozone injections into joints. Especially a gentleman that came in with a tweaked out back. He couldn't hardly walk. And after a few injections into his back there, even he was surprised. His face was totally lit up when he realized he could suddenly get out of a chair with ease. And it was after just those 2 injections. It was amazing. We saw some very interesting stuff. This new bypass major autohemotherapy is incredible. I think that's going to be the new wave. So.
You saw other evaluations too with kinesiology. What were your thoughts about?
Kinesiology, yeah, that's interesting because I always kind of shied away from that whole thing. But having seen it done, doing some of that, I mean, there's no question there's something to do with it, especially when you had that one guy put his cell phone down on his lap, and then even he was surprised, okay, when he saw his muscles just had totally gone. People don't realize what that EMF does to you. So.
Now, you're very familiar, I mean, you know what prolozone is, injecting
Correct.
Joints,
Yes.
right?
Yes.
And you saw me use my means of evaluation, muscle testing, kinesiology, to zero in on where to put the injection.
Right.
Any comments on that?
It makes it so much easier. I mean, you know exactly where it's going to help, which takes all the guesswork out of what are you doing. I mean, you pretty much know exactly where you're going to inject that thing. It was great. It was.
And you saw the results.
Absolutely.
And
Absolutely.
Here's somebody who came in with back pain, and technically you could have felt justified giving him 10 different injections.
Absolutely.
Right?
Absolutely. In fact, you were talking about that initially until you did that kinesiology. Yeah.
And then he only got 2.
2.
At one level.
At
right?
one level, and I was going to say instantaneous. It was not totally instantaneous, but to him it was. He got off the table, sat in the chair, and you immediately asked him to sit up, stand up again. And you saw his face. It was incredible. Yeah. Very remarkable.
And then you saw a woman who has had chronic knee problems.
Correct.
For years and years, and she's having slow but steady gain, correct?
Correct.
Not instant.
No.
But she's had like 5 treatments now, and she's each time she comes in, she's getting another notch up. She's relating 30% overall improvement.
You know it's getting better because she's coming back. She's coming back, you know, and she sees an improvement every single time. So it's remarkable, no question.
You also saw a patient that we're treating who was challenged with pancreatic cancer.
Yes.
Right?
Yes.
And we're not treating the cancer, correct?
Correct. Yeah.
We're treating the patient,
Correct.
right? And what did she have to say?
You know, the whole question that these cancer patients have, of course, is they are all asking, if you're in that crisis of life, you always want to know, am I doing everything I can do? Is there anything else that can be done? And that's the whole thing that you were going through with them, the whole idea that just treating the cancer like we think we're treating is not really the answer. What we should actually be doing is we should be treating the whole patient, and especially the immune system.
The immune system.
Yeah.
And this was a woman who came into us with pancreatic cancer. She needed a stent. And what did you overhear her tell a patient in just a couple weeks of treatment here?
Well, this woman is dramatically, I mean, she's happy. You wouldn't know that this woman has pancreatic cancer at all. And she came in and she was testifying to another person that had cancer, and she had a smile on her face. She was happy. Whereas the other person, much younger than her, he is in trouble. There's no question.
And that woman with pancreatic cancer was how old, Doc? You remember?
84?
84.
84.
Isn't that amazing?
Yeah, yeah.
Look at her
She
zip.
looked great. She looked great.
Her zip, her energy.
Yep, absolutely.
Okay.
Yeah.
Thanks. May I post this on YouTube?
Sure,
Thank
absolutely.
you. Hey, Doc, what were you saying about you were liking something about my history?
In your history, you were actually asking these folk about their stress in their life, about the relationships in their life, about things that really, could be causing as an underlying turning on or a triggering of some of these problems. I mean, cancer happens for a reason. And all we're doing in modern medicine is we're throwing poisons at it without looking for an underlying cause, without looking at what's going on in a person's life that can be affecting the immune system. And I think it's key. In the way you approached it, I thought was wonderful with these folk. And they also, you could see in their faces, I don't think anybody had ever asked them those questions before.
I don't think so either.
I mean, they were kind of saying, well, yeah, okay. And the more you talked about it, the more it came bubbling to the surface. I think that is so good. So good.
Good. To me, it's tragic that medicine's not looking at that, because this is science. It's actually not just me, it's science. We know that in many, many people with cancer, in fact, there's been studies on this, that they've had a serious stress in the last couple of years.
Absolutely. Every single one of these patients we talked to today did.
Yeah.
You found the stress.
Yeah.
Every single one of them.
And we found the stress, and they're either addressing it or it enables them to address it.
Exactly.
Thanks.
Yeah. Mm-hmm.